Hi, my name is Andrea Clark, and I work with BMHC around strategy and vision for where the organization could be heading.
My name is Kristen. I do administration as part of the BMHC coordination team.
My name is Sam. I have been with BMHC for just under a year now. As an active member, I just help with some of the projects and events and just trying to get in where I fit in. I love everything that the organization is doing, so I'm learning how to use my own skills and to develop them while working with the different projects that we do.
My name is Aisha Seabright, and I'm the program coordinator at BMHC.
Actually, to answer that question, I can talk about what started BMHC at all, which is that a bunch of Black people went to mental health events, and as they were talking about mental health, realized that there was a more nuanced discussion that needed to happen, because caring about mental health is great when you don't actually take into account all of the systems that we live in that further negatively affect your mental and physical health. And all of those systems were not made for Black people. And so BMHC exists so that we can take all of the negative things that society was not built for and counteract them with programming that brings back community, it brings back joy, it brings back love, while also being like, here's how you can survive in society and in this life that wasn't necessarily made for us.
BMHC is so important because BMHC is actively doing what I wish all the institutions that exist were doing. It's actually a retransformation of the system. Like, it's actively making sure that we are coming from an anti-oppressive approach, and the principles that BMHC sticks by, inclusivity, solidarity, all of those things, it's actually what we do, and you can see it in all the projects that we do.
Mental health is important because we often abstract our mind from our body, and I think it's a mistake that we make to not think about the influence that our mental health has on our physical health and vice versa. And so this is an opportunity for us to really dig into this part of our lives that gets either stigmatized or ignored, in giving us a chance to have a full experience of ourselves and being able to build that for our community.
It's important for us to do more than just survive. And if you don't take care of your mental health and prioritize it just as much as your physical health, then all you can really do is survive. It's not just about surviving, it's about finding joy. It's about being able to really take advantage of all of the experiences you go through and all of the things you're living, and you can't do that if you can't actually find joy in the experiences and find joy in the people that you're around. But we care about mental health because it means that we can live longer and live more happily and live more joy-filled lives despite what society is doing to us.
Mental health is everything. And even BMHC, another reason why it's so important is it's destigmatizing that. It's making the conversation about mental health okay. And it's making it so managing our mental health is actually attainable, and it feels like we can do that and with BMHC. So yeah, mental health should be treated just as much as our physical health or more. Just like there's walking clinics for physical health, there should be walking clinics for mental health. Why aren't we taking it as serious? So the work that BMHC does is fighting all of those things in society. So yeah.
Mental health is so important because it actually colors every experience we have in life. Literally it's just like your general health. If you're not doing well in your body, you should be able to seek a service that supports you in healing what's happening in your body. And it impacts how we function in life. And if we don't take care of our mental health, then literally our quality of life is lowered, and we suffer and we can't thrive. As a program coordinator, I design programs to educate our community on mental health as well as destigmatize it. BMHC's programs are intended to help community members connect with each other, as well as healers and practitioners from within the community. Some programs I've had the pleasure of working on is our peer support program, our Black Joy Sundays program, our community collaborations, BMHC conversations, and also our BMHC cookout. The BMHC cookout is our annual event in which we bring practitioners and the community together through a cookout style event where we have workshops, activities, as well as a panel discussion where we can talk about mental health live. And it's a space where community members can ask questions and receive genuine contextualized answers.
Black Mental Health Connections is an alliance of organizations and individuals focused on the mental health and well-being of the English-speaking Black community in Montreal. We help our community by developing and offering services that spark bottom-up social change. Our mission is to use our collective experiences to empower members of Black communities by breaking mental health barriers and promoting healing through culturally competent education and innovative community care. BMHC is currently offering programming such as peer support groups, workshops, Black Joy Sundays, BMH conversations, and much, much more. Visit our website to learn how to become a member or to register for our programs.